Observation and News 2. There are 6 physiologic parameters to observation: respiratory rate, oxygen saturation, blood pressure, pulse rate, level of consciousness, temperature. Respiratory rate is the movement of air in and out of the lungs. The normal value for adult is 12 to 20. When counting, watch the abdomen or chest wall rise and fall. Count for a full minute. Oxygen saturation is a measure of how much oxygen is carried in your blood. The normal value when using Scale 1 is 93% on air and 88 to 92% on Scale 2. Scale 2 is used for patients with chronic hypercapnic respiratory failure, conditions like COPD, who have a target oxygen saturation range of 88 to 92%. The decision to use Scale 2 should be made by a competent clinical decision maker and documented in the patient's notes. Top tip: ensure hand is warm and nail polish is removed. Place for a minute or longer to allow the reading to stabilize. Once the reading stabilizes, record the highest reading. Blood pressure is a measure of the force that your heart uses to pump blood around your body. To measure the blood pressure, use a monitor called sphygmomanometer. The measurement used is mmHg, millimeters of mercury, and is given as 2 figures: systolic, the upper number, and diastolic, lower number. Normal value for adult is between 90/60ths of a millimeter of mercury and 120/80ths of a millimeter of mercury. Performing tips: check the following. Patient is relaxed, legs uncrossed. No contraindication to using preferred arm, example, previous mastectomy, and renal fistula. Ensure the cuff is the right size, should wrap snugly around upper arm, enough space to fit 2 fingers underneath. First, locate the brachial artery and then align the artery index marker of the cuff. Place the stethoscope diaphragm over the brachial artery. Inflate the cuff to exceed the estimated systolic pressure, and then slowly deflate it while listening for the tapping sound. Systolic is the point at which the pulsation, tapping is audible. Diastolic is the point at which the sounds disappear. Pulse rate is the number of times your heart beats in 1 minute. The normal rate for adult is 60 to 100 beats per minute. You can locate pulse on the carotid artery, brachial artery, radial artery, femoral artery, popliteal artery, tibial artery, and dorsalis pedis artery. Performing tips: locate the radial pulse by placing the tips of your index and middle fingers on the thumb side of your wrist, just below the base of your hand. Press lightly until you feel a pulse. Count the rate 1 full minute. Next is to assess the rhythm. Regular pulse will feel consistent, with even beats. Irregular pulse might feel like skipped beats, extra beats, or changes in the rate or strength of the pulse. Level of consciousness, a measurement of a person's arousability and responsiveness to stimuli from the environment. Tools to assess consciousness level. 1. AVPU. A is for awake. Is the person alert and conscious? V is verbal. Does the person respond to a verbal stimuli? E is pain. Does the person respond to painful stimuli? U is unresponsive. Is the person unresponsive to any form of stimulus? 2. Glasgow Coma Scale. The scale provides a standardized, objective way to assess and monitor a person's level of responsiveness by evaluating eye-opening, verbal, and motor responses. The GCS score helps healthcare professionals gauge the severity of a patient's condition and track changes over time, with higher scores indicating better responsiveness. Each component is assigned a numerical score based on the patient's response. The total GCS score is the sum of these individual scores, ranging from 3, deep coma, to 15, fully alert and responsive. Temperature is a measurement of how well your body can make and get rid of heat. It is measured by Celsius, degree C, and Fahrenheit, degree F. The normal value is 36.5 to 37.5 degrees Celsius. Performing tips: for oral temperature, check that they have not consumed any hot or cold food or drinks up to 30 minutes before taking a reading. Place the probe tip under the tongue, towards the back of their mouth. For axillary, place the probe tip in the center of the armpit, have them hold their arm against their chest to secure the probe. Other temperature reading methods: tympanic, temporal, and rectal. Now, let us talk about News 2. The National Early Warning Score is a tool developed to improve the detection and response to clinical deterioration in adult patients and is a key element of patient safety and improving patient outcomes. How does News works? The News is based on a simple aggregate scoring system, in which a score is allocated to the 6 physiological parameters as they are measured, with the magnitude of the score reflecting how extremely the parameter varies from the norm. This is the chart we use to plot the measurements of the 6 parameters to calculate total News score. Let's break the chart down. You have a patient admitted due to an infection. The observations are as follows: respiration rate, 19. Oxygen saturation, 94% on air. Blood pressure, 90/65. Pulse rate, 94. Alert but agitated. Temperature, 39 degrees Celsius. Plotting the respiration rate. In this case it's 19, record on the News chart as a dot and look at the News key score, which is 0. Let's record the other parameters. Oxygen saturation is 94% on air. For the blood pressure, record the systolic BP only. Let's continue recording the rest of the parameters. Here's what we got from each parameter. Respiration rate 0. Oxygen saturation 1. Blood pressure 3. Pulse rate 1. Level of consciousness 0. Temperature 1. Add the total score, which is 6. So, what do we do with the score? Looking at this table, the clinical risk for an aggregated score of 5 to 6 is medium. How can I respond to a News of 6 with a medium clinical risk? Looking at this table, it prompts us to escalate. And how often do we do the monitoring? Next thing to note, are there any of the parameter scoring of 3? In the scenario, the patient's BP is 90/65, scoring of 3. Respond, escalate and monitor accordingly. Key points to remember: accurate recording of observations, timely calculation of the News 2 score, effective communication and escalation, utilizing clinical judgment alongside the score.